Hello, everyone, and welcome to this Bostix broadcast as part of this newscast edition, this Bostix bulletin, and this Bostix broadcast as part of a chartered edition and an evidence-based perspective. This is a Bostix broadcast as part of the Communique Tsunami and Bostix broadcast as part of this newscast edition, in line with and I like to another Storm Bostix production. In this Bostix broadcast, there will be an overview in sort of looking at works around a retrospective overview of coping in young people with chronic kidney disease, or CKD. This works was collaborative between 2010 to 2013. More prospectively, this works was presented at the Royal College of Pediatrics and Child Health in the United Kingdom, and sort of retrospectively, this work was published in a peer in as a peer review publication in 2015, 2016, as well. This work was collaborative between colleagues in across sort of several academic institutions in the United Kingdom, and a social media platform organization, and also a youth club, based in the Scotland region of the United Kingdom, and also a children's hospital in the United Kingdom as well. So this works in sort of an overview of this works. The the This Bostix broadcast is as such. So chronic kidney disease in young people impacts on educational and personal development, and many psychosocial complications. Many psychosocial complications can continue into adult life, which reduces the probability of leading a successful, for example, work lives, or social lives. Clinical advances allow young people to conduct sort of modified forms of renal replacement renal replacement therapy, or RRT, in the home, including, for example, hemodialysis, peritoneal dialysis, and nocturnal hemodialysis. In the case of CKD stages 4 and 5, sort of the severe ends of chronic kidney disease, renal replacement therapy, or RRT, often necessitates the development of specific skills. Coping skills. Hemodialysis often challenges sort of young people's coping strategies, and requires continual appraisal of these strategies in times of stress or duress. Coping with CKD at the same time also means living with the risk of where patients in the CKD population, where transplantation is concerned, means living with the risk of transplant rejection, or acute rejection (AAR), and other clinical complication clinical implications as well. So in around this works, there are a little bit about the sort of the theoretical framework before delving into highlighting the specific aims around this investigation. The theoretical basis for this investigation involved a phenomenological approach where the investigators, the researchers, essentially sought to understand coping strategies in young people and to begin from a perspective free from hypotheses or preconceptions. A phenomenological sort of approach and methodology are particularly effective to help individuals thus challenging a sort of perspective, challenging assumptions. Phenomenological investigations also relating to young people with CKD, chronic kidney disease, and other conditions have been carried between works in around 2007, 2012, and in around 2015. And using a sort of an interpretive basis or dimension to phenomenological research also allows researchers or investigators to inform or support or challenge policy and action in around in around sort of the sort of the theoretical framework around the theoretical framework and in context of the evidence in around this works. And so the the objective in around the aims and investigations around this works, the objective of this investigation of this qualitative study or investigation was to identify coping strategies in two groups of young people aged between 12 and 18 years. And in group one, young people had chronic kidney disease or CKD stage 4 to 5 in context of severity, and and in a second group, young people who were involved and participated were healthy. The main research sort of question was, what coping strategies do young people utilize to enable them to cope? And in around this works as well was the basis where there was basis as well at whereby uh, whereby the as part of the objectives the young people that were who were recruited and participated in this works had were participated recruited from a youth club and the CKD cohort, the CKD group or cohort had been recruited from a children's hospital, and both cohorts were cohorts recruited, and those who were involved in this works were participated from the UK, from the two different sites in the United Kingdom. The design around this works young people with CKD stages 4 to 5. There were seven young people, and the mean age was 11.5 years. And young people from the healthy the healthy cohort or group. There were seven young healthy people, and the mean age was 14 years, and between in both cohorts, they were invited to partake in one-to-one face-to-face semi-structured interviews. The findings in around this works identified 11 different themes surrounding coping, in around coping. Uh, the themes around this works included anticipating a challenging scenario, close relationships, coping strategies, demonstrating resilience, physical activity, decision making, pastimes, peer pressure, and looking at and also looking at relaxation and relief as well. In around Relaxation and relief, and also sort of stress triggers and worst case scenarios. The conclusions around this works were for many young people, or for young people with CKD, coping strategies can be impaired by normal daily living activities. This in turn can induce, for example, the enjoyment of friendships or close friendships, contentment with family, and performance in school or work. If young people with CKD have support to utilize more positive coping-based strategies, this may also enable a sort of smoother transitioning from pediatric renal care to adult renal services, where they are required to become, where they are required to be more autonomous. And prospective investigations in around prospective investigation, they should thus adopt a prospective investigation should adopt a similar approach in context of qualitative methodology, but also seek opportunities to encourage greater participation from this population. In around the implications for practice, the investigation highlights some of the insights and experiences of young people with CKD. Findings could allow professionals between pediatric nephrology, for example, to develop a guideline to complement clinical practice and strengthen coping strategies for young people with CKD. Further investigations on coping in around coping should focus on the perspectives of coping from parents or guardians and siblings at the same time. And in around this works as well. The In around this works as well. There is some there is a basis where in around perspective works as well. The themes derived can prompt investigators to potentially develop a sort of coping guideline or framework for young people with CKD. However, a longitudinal investigation would help recognize coping strategies utilized over time, and to provide a pathway for development for a sort of a formal coping framework. This works had or similar works similar works have been sort of published, or where listeners have an intrigue in around this sort of in around sort of similar research. Terminologies in around this have included chronic kidney disease, coping, pediatrics, phenomenology, and young people. There will be some resources in the descriptors on social media where listeners can check out some of the literature, some of the literature in around this works, and in around this works, and this 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 work the full overview around this have been provided before in a previous audio in a previous Storm and Bostix audio podcast series. However, this was part of a news edition and a Bostix broadcast. This Bostix broadcast, I thought here this would be an opportunity. Thought it'd be an opportunity to share this in an overview in context of collaborative works, and also where this works was presented at the Royal College of Pediatrics and Child Health at their sort of symposia, or this conference in 2022. In 2022. So thank you for tuning in on this Bostix broadcast. This is a Bostix broadcast, part of a newscast edition, a Bostix bulletin, and a Bostix broadcast as part of a Storm and Bostix production, and part of the Communique Tsunami, another chartered edition, and this is another chartered edition with another evidence-based perspective. Thank you.